Joining me now via Skype is respiratory therapist, University of Wisconsin-Madison School of Medicine, Kelvin Akinwande. Good morning, and thank you for joining us on TVC Breakfast. Well, in spite of measures put in place by various governments across the world, not just in Nigeria, talking about social distancing and the likes, one thing we keep seeing is the continuous spread of this coronavirus. What really is the challenge? Why are we continuing to see the spread despite all of these measures?
Well, when it comes to the United States of America, the spread mostly is in New York because they're trying to get people to stay home, and most of them refuse to stay home. And like in Wisconsin, where I'm at right now, we have about 3,500 cases. And I live in Madison, Wisconsin, and we have about 360, and we have 13 dead right now. And from my hospital, we have 10. So concerning the social distance, they're doing very, very well in Madison, Wisconsin. But when it comes to New York, Florida, California, they're not really doing well because sometimes there were a lot of mistakes that went on. Like in Florida, they were spring break. Everybody went to the beach for spring break. Even though they were trying to tell the governor not to, he should close the beach, but he did not. He left it open. So that is why Florida is blowing up a little bit right now. Michigan is blowing up, and New York is blowing up. But Wisconsin right now, we have about 350 patients right now. And I work at the ICU department, and right now we have about 30 people in the ICU that they're all in ventilator right now.
Now, as a respiratory therapist, some persons have said that perhaps the compulsory introduction of the use of face masks, even though initially it is said that not everyone should wear the face mask, as only those who are infected should use them. But at this point, some persons have said that perhaps the use of face masks could help curtail the spread. Talk to us from the point of view of an expert. Do you think that that could also help with flattening the curve at this point?
Well, to be honest with you, the face masks, I think it helps more on people with the coronavirus, with the virus. It helps more with them because when they cough, it stays in there, it doesn't go out. But there's a thing called, you can wear face masks when you go out, there's no big deal about it. But the main thing, there are a lot of face masks, you have to test it. Like over here in Wisconsin, whenever we get a new face mask from wherever we get it from, we put it on and we'll light a lighter and we blow. If the fire moves, we know, okay, definitely this face mask is not good. But you don't really need it. To be honest with you don't really need it. But I always tell people to put it on if you know you want to be safe, it's okay. But it's better for people with the COVID-19 to put it on, just not to spread the virus around.
So, stemming from what you have seen so far from your workings with perhaps patients, what would you recommend for the governments of Nigeria to be looking at this point as measures to curtail the spread?
To be honest with you, I just pray that people should stay home. That is just the main thing. People should stay home. Working at the ICU department, I see people looking at me crying that they don't want to die. I see people begging that they would just want to talk to their husband, their loved ones, just one more time, and it's tough. Like we have 6 doctors right now, they just tested positive, and we have to we get tested every day. We get tested Monday, Wednesday, and Friday, and it's not funny when they put it in your nose. It is not funny. So discomfort. It's not funny. I think the government, people just need to stay home. And don't get me wrong, I get calls from people all the time from Nigeria. How come you guys got $1,200? Nigerians are not getting anything. But that is not the main thing. The main thing is this. In America, there's a thing called we file taxes. IRS, we file taxes. So it's already in the system. So they don't need to call. You don't need to make a phone call or nothing. They just go to your social security number. Everybody has a social security number, and it goes into your account. That is different. They don't do that in Nigeria. So I just pray, for the sake of God, Nigerians should just try and stay home, because how many ventilators you guys have? It's not that much in Nigeria right now. Over here, we have about 500. Even though we have about 300 and something patients, but we have about 500 standby ventilators.